difference in of any complication in any of the approaches, except possibly a greater risk of perioperative fracture with the anterior approach. Now, total hip arthroplasty and specifically its postoperative rehabilitation, like most things, is a combination of factors, and we're moving towards shorter hospital stays. In fact, one author reports 80% of his total hip arthroplasties go home the same day. That's not one midnight, but the same day of the surgical procedure. So certainly that is not reflected in my practice. My patients always stay overnight, but it's not unusual for them to discharge on day 1 or 2. And in order to shorten that postoperative recovery, then it's a combination of factors. It's the surgical technique. Orthopedic surgeons used to consider themselves carpenters. Now we like to use the term gardener, where we're more conscientious of our damage to the soft tissue structures on our way to the approach. The perioperative drugs, the anesthesia, regional anesthesia, spinal anesthesia, limited use of narcotics, which is going to limit many complications, including hypotension, which could lengthen a hospital stay and be unable to send the patient home more quickly. And then thirdly, but maybe most importantly, is the rehabilitation protocol, specifically the education part, which in my opinion, preoperative education is unbelievably important. So once we've completed the operation in a very mindful, tissue preserving, conscientious way, once we've had adequate regional